How do TB treatment regimens differ for HIV patients? Have you ever wondered how tuberculosis treatment changes for someone living with HIV? The answer lies in the unique challenges posed by the interaction between tuberculosis medications and antiretroviral therapy. Tuberculosis treatment usually involves a combination of antibiotics over at least 6 months. However, for individuals with HIV, the treatment becomes more complex due to their weakened immune systems. First, let's talk about drug selection and interactions. For HIV patients, the treatment plan must be carefully coordinated with their antiretroviral therapy to avoid harmful drug interactions. For instance, rifampicin, a common tuberculosis medication, can reduce the effectiveness of some antiretrovirals. This happens because rifampicin induces liver enzymes that metabolize these drugs. Therefore, healthcare providers may need to adjust the dosages of either the tuberculosis drugs or the antiretrovirals to ensure both therapies remain as effective and safe. Next, the duration of treatment can also differ. While standard tuberculosis treatment lasts 6 months, HIV-positive patients may need longer treatment. This is particularly true if they have severe disease, do not respond well to therapy, or if they are dealing with drug-resistant tuberculosis. Close monitoring is essential during treatment to detect any side effects or complications early. Another important aspect is the management of latent tuberculosis infection. HIV patients who have latent tuberculosis, meaning they do not show active symptoms, often receive preventive therapy. This is crucial since HIV significantly raises the risk of latent tuberculosis progressing to active disease. Additionally, when starting antiretroviral therapy in patients with tuberculosis, there is a risk of immune reconstitution inflammatory syndrome. This syndrome can cause an exaggerated inflammatory response, worsening tuberculosis symptoms temporarily. Managing this condition requires careful clinical awareness and sometimes corticosteroid treatment. Finally, some studies are exploring adjunctive therapies, like aspirin for tuberculosis meningitis. However, these treatments must be evaluated carefully for safety in HIV-positive patients. In practice, healthcare providers tailor tuberculosis treatment regimens for HIV patients by selecting compatible medications, adjusting dosages, and extending treatment when necessary. Regular monitoring for side effects and treatment responses is vital. Preventive therapy for latent tuberculosis is a key strategy in HIV care to help reduce the incidence of active tuberculosis. In summary, tuberculosis treatment for HIV patients is different due to the need to manage drug interactions, the potential for longer treatment courses, and the complexity of care required to address immune system challenges. These adjustments are essential for effective tuberculosis control while ensuring the safety and efficacy of HIV treatment. Always consult healthcare professionals for personalized medical advice.